report this to a teacher. I don't want to be a tattletale. And these are instances that happened very often. Another story was at church one time. We go to church every Sunday. I grew up very Irish Catholic family. And at one of the churches we went to on Sundays, you know, the parents would go into the church for Mass, and the kids would go separately to play on the playground and learn in a more easy to understand way about Catholicism. And I had actually blocked this memory out, but my parents reminded me of it. They came to pick us up after church, and my brother's glasses were broken. And my parents said to the overseer of the kids' church program, "What's going on? Why are his glasses broken? And why does he look kind of dirty?" And the person said, "Oh, well, someone punched him, but he punched them back," as if my brother was equally guilty. And this is at church. I can guarantee you we never went back to that Sunday school. But fast forward to high school, I have to say too, I carried a significant amount of guilt being able-bodied in ways that my brother wasn't able to. I was very athletic. He's someone who loves sports but couldn't play sports because physically he was impaired. I was academic, always in the highest honors classes. He struggled academically, he struggled with speech, he struggled socially, and that felt unfair to me. And so I felt really guilty about it, but I also felt a really deep obligation that God gave me these gifts. And so I have to do everything I can to take advantage of them and to show God that I'm grateful because there's a reason that he gave them to me. And I often took that to an extreme. So fast forward to high school. Through 8th grade, I went to a school where we didn't have tests, we didn't have grades. You learned independently. We spent a lot of time outside. You could bring your food from home to school and cook it at school. Then I transferred to high school where we were being measured on our grades every day. We had homework every night, we had tests, and I was starting to think, now it's time to get ready to apply for college. And going back to that mindset that I owed it to God to do whatever I could to take advantage of these talents, because people like my brother didn't have these gifts, and so I need to make the most of them. I pushed myself way too hard. I took it too seriously. I was sleeping 5 hours a night to try to make sure I got A's on all of my papers. I dealt with stress by eating junk food in the school cafeteria, because when you go to a school like this, no parents are there to tell you what to eat or not to eat. So I remember eating lots of candy and mozzarella sticks and pasta with butter and no protein, no vegetables, no fruits. And at the same time, I was on the varsity tennis team, and we were the best team in the state. So I wasn't sleeping, I was eating garbage, I was putting a lot of stress and pressure on myself, and my body couldn't handle it. By the time it was my junior year, the fall of my junior year, I became extremely sick. I was sleeping on the weekends, sometimes 17 hours a night. It's not normal. And I was scared to speak up about it, because in my mind, if you're not having seizures and needing an ambulance, you know, you can tough it out. So I tried to tough it out. Eventually, I asked my parents if I could take a sick day, which felt hard to ask for. And they said, sure, but if you think you're sick, you need to go to the doctor. And I was so scared that the doctor would say, nothing's wrong with you, you know, keep toughing it out. We went to the doctor, and actually they called my mom immediately after some of the blood tests came back, and they thought I had cancer. So I had pushed my body way to the brink of burnout. Now, I had other classmates who were able to not sleep, who were able to not eat food well, who were able to stress but not have the level of illness that I had. And it took me about 20 years to understand that what happened in my childhood with my brother actually had a very specific long-term impact on my immune system. Because when you grow up in an environment where there is stress, and it doesn't have to be for your whole childhood, it can be one acute instance, that chronic activation, fear, the nervous system activated, you feel you're in danger. My body came to know that as normal, and that is what felt familiar and comfortable to me. So it's almost as if my body became addicted to that state of being. The problem with that is that state of being shapes your biology. And I'm here to tell you that there is a lot of emerging research showing that stressful experiences in childhood can significantly increase your risk of developing chronic diseases later in life. And this is very much the case with autoimmune disease. So autoimmune disease, some of you may have heard this term, some maybe not. I had never heard of it until I was diagnosed with one. Essentially what happens is your immune system becomes in overdrive. And there are a number of factors that can influence risk for autoimmune disease. Many of the factors you all are already taking care of. You eat well, you sleep well, you spend time in nature, you spend time with friends, you manage your stress, you're very active. There are other things that can influence it, and definitely stressful childhood experiences. So can infections, and so can environmental chemicals. Again, back to what I was saying, that your daily behaviors and your daily environments are what are shaping your health. So in my case, beginning of high school, I was not at the same baseline as my peers. I had a very, very triggered nervous system and immune system that many others who I knew didn't have that. Even my younger siblings didn't have this, because by the time, so I'm child number 2 of 4, by the time child number 3 was born, we had almost figured out my brother's condition. So she was exposed to much less of it than I was. I'm happy to share with you that when my brother was diagnosed, what they found, the problem was that his body could not translate glucose in the way that the rest of our bodies, when you eat glucose, it converts into energy. He's lacking the protein that puts glucose into the brain. And so anytime he's eating glucose, it's disrupting that pathway, and that is what was causing him to have seizures. So at the time, this was over 30 years ago, they put him on what's called the ketogenic diet. Some of you may know this diet. Essentially, you take out any form of carbohydrate or glucose. And remember, after many doctors telling my parents, this is a hopeless child and you should put him away in an institution and visit him sometimes when you want to later in life. After he went on that diet, all of his seizures stopped. And he has essentially never had one since, unless he's cheated on his diet. So I learned very early on the power of food as medicine. And food as medicine was very influential in my healing journey with autoimmune disease. So I'm standing here today. From that point of diagnosis in college, I was diagnosed with celiac disease. Very often, if you have an autoimmune condition, you're more likely to develop others. I developed a number of others, and it took me many years after the first initial diagnosis of celiac to understand that I needed to retrain my nervous system, to remind my body that I'm safe. And in my case, I needed to change my diet. I needed to sleep more. All of those things, in the end, they worked. And I have clinically reversed 2 other autoimmune diseases that I used to take pharmaceuticals for every day. And I was told that for the rest of my life, I would have to take these pills, and that's just the way it is. But I'm here to tell you that's not the case. Your body is very adaptable, and you write the story. So I want to share a little more insight with you about autoimmune disease, and then about some other maybe unexpected sources that can contribute to chronic disease that you may not be thinking about, because most people in medicine don't talk about these things. And I hope that it's enlightening for you and interesting for you. It was really fun for me to think through what I was going to share with you today. So autoimmune disease is growing astronomically in our country. I wasn't able to find statistics on prevalence locally. You probably have better insight to that than I do. What I was able to find is that all of you have generally stronger immune systems because you're spending so much time in nature and exposed to microbial diversity. You eat better diets, you are very active, and you're have strong social connection and purpose in life. But there still are, all of us face adversity and things that are unexpected that we have no control over. For example, who could have controlled that my brother had this genetic mutation that caused him to have seizures, or that kids at school would then think it would be okay to bully him? But there are many things that can cause childhood stress that are unavoidable. For example, maybe someone in your family has an illness or dies. Maybe there's an especially hard season or a couple of seasons where crop output is lower because the weather has been terrible. No one can control the weather. And these things might seem subtle, but to It's more about how your body perceives what's going on. So if your body feels unsafe, it starts to internalize that, and that's what shapes your biology. So autoimmune disease is very interesting because while you need to have a genetic predisposition, the predisposition genetically is not what dictates whether you have the disease or not. There are numerous studies done in twins, looking at identical twins who have the same exact genetics to see if they both had the gene, did they both get the disease? And the statistics vary because there are so many different autoimmune diseases. There are more than 80 of them. But the statistics range from 50 to 90% of the time, only one of the twins will get the disease. So an anecdote, a good friend of mine recently had a very complicated pregnancy with twins. She was on bed rest for 3 weeks, and then the twins were in intensive care for a month after they were born. One of the twins faced a lot more stress inside the womb than the other. Both twins were born with the gene for celiac disease, which is the illness that I mentioned I was diagnosed with in high school. By age 2, one of the twins had it active celiac, and the other still doesn't have it. They're now 4 years old. So what else can I tell you about autoimmunity? Oh, I wanted to tell you that while I couldn't find local statistics about autoimmune disease specifically in your community, I was able to find that you all have much significantly lower rates of asthma and childhood allergies by orders of magnitude. So the numbers that I found were about 5% incidence of asthma versus the rest of the country is 8 to 10%. And then for allergies, I found about single-digit rate of childhood allergies versus the rest of the country is 40 to 50%. So what that suggests is that there's strong baseline immune system. So would hope that that would translate to lower incidence of autoimmune disease. But autoimmune disease or not, I use my story to illustrate for you the various things that can contribute to illness, whether it's autoimmune disease or something else. So back to the quickly childhood adversity. What the numbers show us is that children who have stressful childhood experiences, and again, it doesn't have to be something dramatic, it can often be subtle, 2 times more likely to develop diabetes or heart disease, 2 to 3 times more likely to develop COPD, 5 times more likely to develop obesity, much higher risk for depression, shorter lifespan, and anywhere between a 20 to 100% higher chance of developing autoimmune disease, again, depending on what the autoimmune condition is. So people become ill not because they lack discipline. In many cases they do, and like I said, that's a problem for the rest of the country. That's not a problem here. But childhood experiences literally shape your nervous system, they shape your hormones, they shape inflammation and immune function. So I want you to all be mindful of that, and I hope that maybe if some of you have struggled with illness, for me it was very empowering when I learned about this. At first I felt like I couldn't accept this thinking because I would be in a way blaming my parents, but it's absolutely not about blame. It's about what you felt in your body from external experiences, and my parents had nothing to do with making me feel scared. So whether it's you or you have children who might be having a hard time, just to be more aware, I think is empowering. The next thing I want to talk about is that oftentimes underlying infections can trigger autoimmune disease or other illnesses. I know you're going to hear more about Lyme disease after me, but I want to acknowledge, it's becoming an epidemic here. Over the last 5 years, the rate of Lyme, as you all likely know, has increased seven times what it was 5 years ago. And while I'm not an infectious disease expert, I can tell you that any sort of infection is a challenge for your immune system. And back to thinking about your body as a seed, the best thing you can do for that seed is to make it resilient, to every day work away at nourishing it, giving it the right food, helping it feel safe and loved, making sure it gets enough sleep, such that when you incur an unexpected infection, whether it's Lyme or something else, you give their body the best opportunity that it can have to weather that storm. Now, the last thing that I want to share with you, thinking of daily behaviors and daily environments, unexpected things that you might be exposed to every day and not realize it, or maybe you realize it but would never think this could impact your health. It's actually hearing loss. So I learned recently that agricultural communities, 74% of workers reported in a study that they're exposed to high levels of noise every day from often the machinery that you're using to do their jobs. 30% report not wearing any sort of protective hearing equipment. 15% have significant hearing loss, which is more than double the rate of the US population. So what's the big deal? Yeah, maybe we all lose our hearing as we age. But there's actually significant chronic disease implications from hearing loss. First of all, I don't want to say the wrong number. So hearing loss is associated with a 72% higher risk of dementia. Dementia is a risk factor for many other diseases, including neurodegenerative ones. And a recent study at Johns Hopkins of older adults with hearing loss found that 38% of these adults reported being very lonely. Of course, loneliness is sad, but it also has serious implications for your internal health. I know that you all, part of your culture that I admire so much is community and family and spending time with loved ones. This is especially important if someone is experiencing hearing loss. So social isolation, or in other words, feeling lonely. A recent study done at Harvard found that people who experience chronic loneliness had a 56% higher chance of having a stroke, 30% higher chance of having heart disease or premature death. Loneliness is also increased to higher risk of type 2 diabetes, depression, and anxiety. How does this happen? Well, you think about if you can't hear well, much of socialization is engaging in conversation, listening, and what the research shows that oftentimes people who are struggling with hearing loss, who aren't treating it, who may not have a device to help them hear better, they just start to disengage because it's too taxing to try to hear and then to try to participate. So I want to read you some numbers about volume of farming equipment to give some context. So conversationally, when you're just speaking to someone face-to-face in a normal conversation, generally that's about 60 decibels of volume. Right now I'm speaking to you through a microphone. This might be more like 70 to 80. Where things start to become disruptive is 85 decibels and above. That is where if you have long repeated exposure at that volume, it can start to cause significant hearing loss. So a tractor tends to emit about 85 to 100 decibels of volume. Grain dryers and augers, it's about 110. Chainsaws, 110. Gunshots, 140. So operating a chainsaw at 110 decibels without any sort of hearing protection can become dangerous within 2 minutes. And this is something that you may not even feel as pain or discomfort. Honestly, sometimes loud noises can be therapeutic. I'm someone who loves to listen to loud music. But it is challenging for the brain, and when it's done every day over and over and over for hours and hours and years, it does impact the brain. So I think that's all the statistics that I wanted to share with you on that, but really my point in bringing these up is not to say that you're doing anything wrong with your farming equipment or you're doing anything wrong raising your children. It's to highlight the examples that your long-term health is the sum product of everything that you live and experience every day. And I'm so honored to be with all of you who are doing so many of these things so much better than the rest of the country. Like I said, a big part of my job every day, and my teammate Nora's job, who's in the back there, we're trying to get the rest of the country to live like you all. But we're also trying to help people understand that as much as you could try to be perfect with every behavior that you do, eat the perfect diet, exercise or be active every day, have amazing purpose in life, sleep as much as you need to every night, and on and on. Think of a flower, you plant that seed, your body is your seed. As perfect as the flower might try to behave and make itself grow, it does not have control over many of the things that it needs to thrive and bloom. Storms, it needs water, it needs sunlight. It needs neighboring flowers. It needs other animals in the ecosystem. So I hope this is empowering for you to hear, and I'm here to tell you that you write your next chapter. You are the author of your story. I'm living proof that you can struggle significantly with disease and you can overcome it quickly. My brother is a great example of that as well. Went from being told this person doesn't even have any opportunity to having a meaningful life. He was also told that he would never graduate, he would never develop beyond a level of intelligence of I think they said something like a 5th grader, whatever that even means. And my parents dismissed that and made sure that he had help in learning and that our siblings normalized him. And once he went on that ketogenic diet, his IQ increased 30 points, which is almost statistically impossible, but it's because his brain was starved for energy. And he went on to graduate college with honors. He made the honor roll multiple times. He works multiple jobs, and I'm so proud of him. And I'm so glad to share my story with all of you today. I hope it helps give you some perspective on chronic disease. And I guess I'll just share that, chronic disease, like I said, is #1 cause of death and disability in America. It's largely preventable. These illnesses are much as 80% preventable. As a country, we're spending 90% of our healthcare budget treating these illnesses after they arrive versus investing in preventing them before they get there. And the solutions are very simple. So thank you all for the beautiful work that you do every day. Thank you for inviting me to your community. I'm happy to answer any questions. And with that, I'm finished with sharing my story. Does anyone have questions? Okay, seeing none, I thank you for everything, and I will be around afterward and be around tomorrow as well. So I hope to meet you. Thank you.
Thank you, Kelly. Take this off. Okay, we're going to switch out technology here for a second. Yep. Need the clicker here. Okay. So this next individual that's coming up, I've gotten to know quite well because he is the doctor that treated me in Germany. And I think we've had 20 or 30 people from this immediate community go over and get treated, including our friend Jonas right down here. He was here last year. So I'm just going to introduce now Dr. Julian Dawes, my friend, and also the man who eradicated Lyme for me.
Hi there. How's everyone? You sound tired. Was a long day, wasn't it? Good. With more energy, how are you? Good. It sounds a lot better. So, as people might know me from last year, and people that approached me saw me around or heard some crazy stories about this weird German doctor that comes here to Ohio and starts taking patients and claims that he can cure them of Lyme disease. So I want to fill in a bit of that void that you might have, and I want to show you what our approach at St. George Hospital is. You've probably heard that sentence. It's all in your head. Either you or someone in your family or someone that you know might have heard this. They had a health journey for quite some time. And in the end, just because the doctors didn't find anything, they tell you it's all in your head. And maybe raise your hand if you had someone in your vicinity or yourself, and you know that someone has been told that by a doctor. Oh yeah, that's quite a few. So the thing is, the doctors might be right. It's all in your head, but not for the reason they think, that you have a psychological problem. But most of the patients that I see actually have an infection in their head. So these patients have to be trusted and have to get the benefit of the doubt, and actually, until proven otherwise, believe them that something is wrong in their head. And the thing is, I learned it not only as a physician. I'm now in the 7th generation doctor. My father taught me from when I was little, so I learned how to put in needles and how to draw blood when I was 5 years old. When I was 12 years old, I was taking the medical finals, and I was lecturing at Harvard when I was 17. And I was also a student at the Mozart Conservatory in Salzburg. I was a professionally trained pianist. Until all of a sudden in 2019, I went with my father to the US, and I gave a lecture on exactly that topic, that why antibiotics fail in chronic Lyme, even if the patients are asymptomatic. So I came back, and before that I did a normal curiosity test, like every other, every doctor has some curiosity. And I sent a lab to our infectiology lab that we work with, Armin Labs, and it came back positive. At that point in time, I was very healthy. I was running 10Ks every day. I didn't struggle from anything. I was at the peak. So I came back, I had this positive test, and I was like, I just lectured on this, that antibiotics also fail in these patients, and I'm going to explain to you in detail why. But obviously not with me. With me, antibiotics work, right? So this is what I did. I did 2 weeks antibiotics. Did I feel better? Obviously not, because I didn't have anything. I actually felt worse due to the side effects of the antibiotics. And there I was, didn't feel anything. A couple of months in, I had a common cold. So my nose was running for 3 days, nothing major, I wasn't even at home. And all of a sudden, a few days later, my left arm went numb. I wasn't able to play the piano anymore. Initially, I thought, okay, maybe I have a pinched nerve. Then it started with my feet. My soles went numb. It rose up my legs. Then I had joint pain all over my body, in my fingers. Then I was on morphine, and within a couple of weeks, I was actually mainly bedridden and wheelchair-bound. Then I started to develop neurocognitive symptoms. I called my now wife and told her the same story 4 times, and couldn't remember that I already told her this story at that day already 3 times. And remember, I was already a Lyme specialist. My father is was a Lyme specialist. And I knew I had a positive test a couple of months before. But did I personally believe that Lyme could knock me over? No, I did not. We have seen thousands of Lyme patients and successfully treated thousands and thousands upon Lyme patients. But we have never observed someone deteriorate firsthand. So there I was, doubting myself that Lyme can knock me down that hard. And I thought, like every patient goes through this, oh yeah, maybe I belong in the loony bin. Maybe I'm just crazy. Maybe it's a burnout. My life is pretty hectic. And, I went to this psychosomatic hospital, and fortunately, 3 days in, they were like, I'm really sorry. I don't think there's something wrong with you mentally. We actually think there's something wrong with you physically. So with my last 3 working brain cells, I sat down and did the same consultation with me as I would with my patients. And obviously, I not only found Lyme that was still there, but I found a batch of co-infection with me as well. So what did I do? The last thing I ever wanted to do is a treatment in my own hospital, being treated by my own staff. Because as part of one of the treatments, I'm going to talk about the hyperthermia treatment in a second, I have to lie naked in front of my staff and they have to put a catheter up inside me. Who wants that? So there I was, I did it, and my own clinic brought me back. And to be honest, it was life-changing for me. Because before, I was, I knew this disease like no one else before already. There may be 10 doctors in this world that have the amount of knowledge and education in this specific field like I do or like my father had. So, but there's one thing that no textbook can ever teach you, and it's how it feels. And I had that feeling, and I tell you, as a matter of fact, if I didn't have my own clinic, I probably would not be alive today, because every Lyme patient that goes through this every single day with all the distrust and disbelief from their family members, from their friends, the seclusion, the isolation that you have to go through, because one day you're better and the next day you don't have the energy to keep up with it. All of this is so cruel, and the disease does not have the dignity to kill you. So these patients get very old and they suffer their whole life. Lyme actually is an ember inside your body that hides. So it's inside the dry walls and there is smoke coming out, and your immune system sees that there is smoke, but it can't find where it comes from. They're shapeshifters. They have so-called pleomorphic shapes. So the immune system, the soldiers, they come out, they take a mugshot, they see that foreigner doesn't belong here, and they call reinforcement. So they send the mugshot, so-called antibodies, out, and they have police and soldiers ready to arrest. But in the next 20 minutes, they already shifted their form. So the antigen surface proteins, they can shapeshift, and our immune system can't detect it anymore. This is why this is such a very, very, very interesting disease, because it can actually evade our immune system. So, and it has ton of the symptoms. If I write all the symptoms that belong to Lyme onto that screen, it basically can cover and imitate over 100 diseases, and not only the typical joint pain, muscle pain, but also neurological, so brain fog, concentration issues, numbness and tingling, like in my case, light and sound sensitivity, smell irritability. It can mimic MS, Parkinson's, Alzheimer's. It is, in the medical field, we also call Lyme the great imitator. So, and why does the standard approach, what is the standard approach? So the CDC recommends two things. So first of all, it's either 14 or 21 days of doxycycline. If you're allergic to doxycycline, we have amoxicillin and clavulanic acid. If that doesn't work, or if you have neuroborreliosis, we have 3 intravenous antibiotics. And if that doesn't work, although the infection still persists, you have post-treatment Lyme syndrome. So basically we say the infection is not your issue. You basically have an autoimmune dysregulation in a post-infectious state. But that's not true. Actually, we can find and see them hiding inside the cells. We can see them hiding inside of biofilms. Biofilms are like bubble wrap and duct tape. They wrap themselves in, and actually antibiotics, they cannot penetrate these biofilms. So they hide inside your joints, inside your muscle tissue, inside your nervous tissue. and they wrap themselves. So if you take antibiotics, and antibiotics, most people, and even there are quite a lot of doctors that don't understand how antibiotics work. Antibiotics do not go into your system and they look out for that specific bacteria and they shoot. No, most of the antibiotics work on the replication mechanism. So whenever one cell divides and we have two daughter cells, right in this separation mechanism, it goes in like a little scissor and it cuts both in half and both are dead. This is why it works so well in a common cold, because there we have a replication cycle of 20 minutes. So every 20 minutes, the population doubles. So when you start taking an antibiotic with your cold, within 6 to 8 hours, you will feel a lot better, because every 20 minutes, now the population halves. So Lyme has been proven to be in a dormant state for up to 15 years without replicating. And then antibiotics are usually specific for an intracellular activity or an extracellular activity, so they either work inside our cells or outside of our cells. And then we have the blood-brain barrier, because most of the medications you actually take, and also most of the supplements, they can't pass into our brain, which is a very good safety mechanism. So the medications that you take, and especially also the antibiotics, they can't get to where the infection truly is. And then the last thing, and that's the cruelest thing about this, this disease, it can be in a form called persistiforms, L form, cystic form, round bodies. It has several names that all mean the same thing. So they're basically dormant. They can stay like this for 15 years, and they produce endotoxins, so they intoxicate you, make you sick, but you actually can't do anything about it, because they will take their surface proteins, what makes them identifiable for our immune system, and they put it to the inside. It's like when you take your clothes, when you take your jacket and you wear it the other way around. It's a totally different thing, and that's what they do when they try to hide from us. So this is why antibiotics cannot win. Now, if you actually want to have true success, you would have to theoretically combine an intracellular, an extracellular antibiotic, a biofilm-rupting agent, and an antibiotic that can pass the blood-brain barrier, and there are not so many of that, and take that for 15 years. Do you see a problem with that? Good. Yeah, we also talk about microbiome and longer durations of antibiotic exposure. You get a whole different set of problems if you would do that. So we don't just do one therapy at the clinic. So you've heard, okay, this is the clinic that does hyperthermia, so we basically put the patients in a cooker, and on the other side they come out and they're Lyme-free. It's not nearly as simple as it sounds like. First of all, with every chronic disease, and this is what we specialize in. Yeah, we're known as the Lyme Clinic because we're probably the greatest authorities when it comes to chronic Lyme, and especially the treatment on it. But we treat all sort of rare diseases, all sort of immunologic dysfunctions, and basically all sort of lost and rare cases. And for them, the most important thing is to find the cause. So we go out and go on a deep dive. If you come to me, I will sit down initially with you for at least 1.5 hours. I'm going to know everything about you. I'm going to know where you traveled when you've been 12 years old. I will know every sexual partner you ever had. I will know everything, every tropic country that you visited, because I want to find every potential cause that got you into this state. And then we have to send the cleaning crew. We have to send everything, and we have to remove everything that might make you sick. After that, we still have an aftermath. I always call these little boogers, I call them terrorists. And our body is this metaphoric city. So these terrorists come in, they bomb the city, and most doctors start with rebuilding the city without ever looking for the terrorists. Is that wise? No. So here I am as a doctor, I come in, I personally take the nuclear weapons, I destroy the rest of the city, and then I rebuild it from scratch. So this is what I do, and afterwards, we still have the state of inflammation. So we got rid of the terrorists, but we still have a dysregulated immune system. We still have elevated inflammation markers. We still have inflammations in the brain, so so-called microglia activation, so the brain fog can even persist for a very long time after you actually got rid of the disease. There are also treatment modalities for that. But after we got rid of everything, we have to repair the damage. Good. The good thing is, and this is something that my father found by total serendipity in 1996, he had a cancer patient, and my father was one of the frontiers in integrative oncology, so he used artificial fever treatments to improve the response to chemotherapy in cancer treatments. So he was a university professor in Germany, and this is what his research was upon. Then he founded the clinic. And in 1996, he had a breast cancer patient from the US, and she came to him and said, "Dr. Douwes, I'm actually not suffering of my metastasized breast cancer that I'm dying of in 6 months. No, I'm actually suffering of Lyme disease for 7 years." That was her main problem. She was actually complaining of her Lyme disease more than of her cancer that is killing her. And she said, oh, she has so much mental fatigue, she doesn't have the will to live anymore, not because of her cancer, that was already there before she had the cancer. And my father put it on, she said, okay, then take 2 weeks of doxycycline. She said, I tried everything, including that, nothing worked. So he discarded that because there was something at hand that was actually actively killing her right now. So he continued with his cancer treatment. And part of the cancer treatment is whole body hyperthermia. We heat the body up to 106.8 Fahrenheit for 2 hours, and cancer patients receive their chemotherapy during that heat. 2 days later, my father went on grand rounds. She sat up in the bed, and she said to him, "Dr. Douwes, what did you do? You put the sun back in my brain. I can finally think again for the first time in years." So my father was very happy about it. He didn't evaluate it at all. He didn't even put it on Lyme. He actually thought, okay, during hyperthermia you sweat out a lot of toxins. Probably you just had some heavy metals or a chemo brain, and that just cleared up. 6 months later, he had an almost identical patient. They didn't have anything to do with each other. It was an ovarian cancer patient, same story, suffering of Lyme, going into the hyperthermia, came out, and she was good. And this is when the whole research started. So my father went down the whole rabbit hole and found out that actually in 1927 there was already a Nobel Prize for a different disease, syphilis. Syphilis, you know, as an STD, today very easily treatable with penicillin. And back then there was no antibiotics. So the guys came back from the First World War. The soldiers slept with everyone on the front, and they came back with syphilis, and they ended up in a wheelchair. And there was no treatment option for them. And he thought, okay, a fever is usually good when the body has a fever, the immune reactions go up. And what disease causes high fever spikes? It's malaria. So he took the blood of infected malaria patients and injected those into the sick syphilis patients. Because one weird thing, syphilis patients, as well as most of the Lyme patients, can't develop a real fever anymore. So he did that back in 1927. The patients got severe fever spikes. And out of the 17 patients, 15 of them were cured of syphilis. They got out of the wheelchair, they were good to go. He got the Nobel Prize for that. Syphilis and Lyme are very closely related. So both are spirochetal diseases, and they're structurally almost identical, just that Lyme is a lot more complex, but the rest and also the transport mechanisms are almost identical. So we collaborated with a university in Austria and actually proved that all Borrelia strains, all known Borrelia strains, die at the temperature of 106.8 Fahrenheit when it's held for 2 hours. And that's actually what we do with your body. So we put you asleep, and then we put you into the cooker, we heat you up, until your core body temperature is at 106.8, and we hold that temperature for 2 hours. You get out, and all the bacteria died off. That's what made us so successful since over 30 years, and we treat everyone. We treat the simple guy from India, we treat the Amish, and we treat the most well-known VIPs in the world. You get anesthesia. It's not general anesthesia, you're breathing yourself. So it's the same as when you go for a colonoscopy. Good. What else can we do? We do, especially for co-infections, we do photodynamic therapy. Maybe you've heard that UV light is able to disinfect and kill off basically any pathogen. It's actually used in most modern surgical floors to disinfect after surgery. We not only use disinfecting agents, no, we actually use light to disinfect. And we use the same principle inside your blood. So we take a glass fiber catheter, put it up inside your vein, and give you a photosensitizing agent before. So we put that color, which is vitamin B2, that reacts to a specific wavelength, to a specific UV wavelength. Then we basically create a black light party inside of you. So your whole blood starts to irradiate from that single glass fiber catheter. And we kill off any pathogen that is in your bloodstream. The next treatment option that we have, and apheresis is the covering term for this. We actually have 16 different modalities of blood filtering machines at our clinic. So we can filter microclots that are COVID related. We can filter out any autoantibodies. We can filter out any toxic debris. We can filter out heavy metals. There is nothing that we can't filter out. And in the worst cases, we actually do something called the plasma exchange. So we take out your blood, imagine it like a big oil change at the car, throw it away, and give you just pure protein back. And then your blood actually regenerates over 24 hours everything that you need. So it's a big restart. The most important thing is, there are several clinics that claim that it works for Lyme. You have to eradicate the disease before. Because if you do a restart in a malfunctioning immune system, it can actually be quite dangerous. You have to get rid of the infections first. The sequence matters the most. First get rid of the infections and then do any rebuilding treatments. There are great clinics out there that do a lot of IV therapies, NAD drips, amino acid drips. It's all great, but it's even better once the terrorists are gone. So how do we rebuild? So we're at the rebuilding phase right now. How do we do that? So first of all, we have to detox. We have to get rid of the debris that is inside your system. So all sorts of environmental toxins, all sorts of inflammatory proteins, inflammatory cytokines, we have to get rid of them. Then your mitochondria, the powerhouse of the cell, this is what actually gives you energy. And when you have chronic stress for a very long time or chronic infections, those actually get destroyed. And they actually reduce in number. So we have to help the body to produce more mitochondria. And how do we do that? By exposing the body to controlled stress. So there are things like hyperbaric oxygen treatments, there are things like altitude training, there are things like cryotherapy, so where we put you into a cryosauna or infrared sauna, several things, also protocols you can do at home because mitochondria do not rebuild within a week. So it takes some time, but there's an individual protocol for you. And as I already told before, the microbiome, so the bacteria living inside of us are essential. That's our second brain. So they can control what's going up in here. So that has to be restored as well. In patients that had a very long antibiotic exposure, most Lyme patients that have been with 10, 15 doctors, and on average, before patients come to us, they've seen 9 to 12 doctors. I think the biggest record I had last year was a patient that came with 3,800 pages of doctor's notes, and she has been with 230 doctors. And no one was able to find anything until she came to us, and now she's healthy and kicking life's ass. Good. So, clearing the infection is only half the story, because now we got the terrorists away, the city is still destroyed, and our body is very adaptable. We can fix a lot of things, but the problem is things that have to stay in rhythm. We know it from the heart. This is things that that most people somehow in their vicinity have familiarity with someone that might have arterial fibrillation, that has a pacemaker, or that ever had a cardioversion because their heart was out of sync. That doesn't work so well with the brain, though. So most people that have chronic infections, they have chronic tiredness, and they have concentration issues, they have brain fog, they have trouble remembering words, they have mood irritability, they're just not themselves anymore. But is the brain actually broken? That's the big question. In most of the cases, obviously not. It's just out of sync. And imagine there is an orchestra here and you have 30, 40 different instrumentalists, and everyone plays the right notes, but one started a second early, the other one started 2 seconds later. How would it sound? Although these are the best violinists in the world, the best pianists, it would still sound pretty bad, right? And that can happen with inflammation inside your body. It gets your brain out of the natural rhythm. And this is something that we can retrain. So maybe you've heard we have brain regions. We already know that since the 1920s. So we've mapped where exactly in the brain what operation happens. So right in the middle between ear to ear, approximately we have our motor cortex. So the right side of the brain controls the left side of the body. We can do a quick exercise so everyone can see if their brain is dysregulated. Everyone, extend your hands. So the left hand starts tapping. So now this is the right motor cortex, and the right hand starts turning. Good. So who do I see? Okay, I see, there I see a dysregulation. Over there I see a dysregulation. Now switch. Good. Another dysregulation back there. There's one there. There's one there. So, these centers, the motor cortex is basically, the right side, again, is for the left side of the body, the left for the right, and they should work totally independent. What don't I want to see? If you turn the right hand, and the other hand turns at the same time, that is a shadow signal. So basically there's a wrong wiring, basically a short circuit between those two areas. Because the brain is very adaptable, it tries to fix things when there's inflammation. We have highways in the brain, and when the microglia cells, and that's the immune system in the brain, because our brain doesn't have a real immune system, if that gets activated, the highways and the nervous system around that area gets shut down. It's basically, it puts a stop sign there and you have to take a detour. So imagine if all your thoughts and everything you have to process runs through the countryside roads instead of the highway. This is how the people actually feel. And for the motor cortex, if you have inflammation for a longer period of time in your brain, actually it will create a permanent wiring between areas that shouldn't be wired up. And that can be fixed. So, and between those areas, nowadays, that happened in the last 10, 15 years, we've identified the exact brain network. So how the wiring between those different areas exist and how they up and down regulate these different areas. Because obviously we don't just have these these areas that do not work together. Everything has to work in synchronicity, and that's what the brain networks are for. The three most important that make you you are the default mode network, the salience network, and the executive network. And I'm going to quiz everyone tomorrow, yeah? So be prepared. So the default mode is basically your self channel, the internal reflection. So when that is dysregulated, you usually have anxiety, you usually have chronic pains because you have a false internalization inside the body. So up and down regulation of that usually causes a train of thoughts. So you always run in circles with your thoughts, or you can't go to sleep because you can't shut down. You always feel everything inside your body that is basically dysregulation of default mode network. The salience network you can see as the switchboard between being in the normal rest and digest and the executive function, and it also works as a filter for what happens outside of the body. Probably everyone knows a person that is very hyper aware of any sound. So when someone speaks back there, they can't concentrate. Or if there's a smell in the room, they immediately get a headache. Or if the light is too bright, they immediately get a headache or are too sensitive. That's the salience network. If that is dysregulated, that would be symptoms to look out for. And the executive network, that's where you remember, and that's where you think hard. So this is what you need to run a business. That's what you need to excel in school. And that's what most patients immediately feel when something's off. So if those networks are dysregulated, and usually it's not just one, can you see that there might be a problem? So what can we actually do to fix that? So now the infection is gone, but we still have this dysregulated nervous system. And some patients get out of it immediately, and some patients can have it lingering for years. So there are different treatments that we offer at the clinic that basically address any neurological or neuropsychiatric disorder. So the first and foremost would be the TPS, the transcranial pulse stimulation. It's mainly FDA approved, so that's the main indication for Alzheimer's disease. It uses an ultrasound shockwave, so it's just sound, that was used in the past for muscle or tendon, for destroying ligaments and tendons in pro athletes to help them recover faster. Did you ever wonder why athletes, once they get injured, they're back on the field in a couple of weeks and you have that couple of months or years? They have all the tricks up their sleeves. And that's one of them, shockwave therapy. And we use that on the brain. And with this, we can get your brain, even an old brain that is 80 years old, back into a plastic state of a 4-year-old. So you can grow new nervous tissue. You can grow new synapses. You can grow new vessels. And especially also in post-stroke patients, you can save the damaged tissue. So that's the TPS treatment. We use it off-label in almost all neurological, neuropsychiatric diseases because that can repair the pathways and clear the highways again and lower the inflammation in the brain and the microglia activation. The next treatment would be the transcranial magnetic field stimulation, where we can get a bit deeper just with a magnetic field. So we have a 3-dimensional navigation system to send magnetic pulses, to induce a current in the depth, to fire or help you yourself fire your nerves. These sessions last between 3 and 5 minutes for the rapid sessions, where we have 5 to 6 sessions a day, or longer 20-minute sessions where we have 1 session per week over a longer period of time. Then we have neurofeedback training. Neurofeedback training basically visualizes your brain waves or specific brain regions with a specific target for you. Let's say someone was in a wheelchair for a pretty long time and he doesn't know how to use the muscles anymore. We can visualize the feedback mechanism between the muscles and the brain on a computer, and we can show you and visualize you when you actually give the right signal. So you have a visual input when your brain does the right thing, because how can you control your thoughts if you don't know what they're actually doing? And this doesn't only work on muscles, but it also works on false thought patterns. So, for example, in ADD, ADHD, if the person can't stay on a task and the thoughts always deviate, there are specific patterns in the brain waves that we're looking for. And whenever that happens, they hear a sound, they hear a click. So the brain immediately gets aware, oh yeah, I was drifting with my thoughts, so they go back on task. And if you do that long enough, the brain starts to clean up after himself, and it starts to restructure and retrain. And that combined with another treatment that is not on here, the transcranial direct current stimulation. That's a home device that you can take home with you. We use microcurrents where we can either upregulate or downregulate specific brain waves and brain areas based on a so-called brain mapping session. So we can look very deep inside your brain. I actually have my diagnostic tool with me, so if anyone is interested, I think we have 2 or 3 slots available for tomorrow for a brain mapping session. And based on that, we can also provide you with the correct treatment to actually get your brain back into synchronicity. And something very important, the vagus nerve, our rest and digest nerve, the longest nerve inside the body. And let's do a quick exercise. Everyone close their eyes and take a deep breath in through the nose and long out through the mouth. Again. Do you feel a bit calmer? When you take a deep breath and your chest fully inhales, it stretches, it gives a slight impulse to the vagus nerve, and that helps you to calm down. You also see that in animals. The animals usually do a double breath. When a dog lies down, he usually does. They basically turn up the vagus nerve regulation. So this is also neuromodulation, just on a natural way. So why do we get results that other clinics or other doctors don't? The thing is, it's not one device, it isn't one treatment, it's not one thing. It's looking at you individually and combining the mosaic, and we just have the ability to have all the tools that you need, and there's no normal practice that can usually afford the amount of equipment that we have in order to be able to deal with all the diseases. You know, my staff are also not always happy with me when I come every other month and say, oh, I want this new toy for $500,000. But good thing is that I can buy it, and I'm the one that has to sign off for it. But this is very important. I need all these tools. I see every patient that I treat in front of me that I'm going to war with him. So we have to be prepared. And you need as many tools as you can get, because you don't know what waits inside of Pandora's box once you open it. Because it might seem that you have Lyme, but you don't know what lies underneath there. Maybe there are 6, 7 other chronic infections. You don't know what actual damage has been caused until you actually got rid of the first layer. So tomorrow, if anyone is still interested, you can come, you can do a brain mapping session, you can take a look at your own brain, you can see what is actually dysregulated. If there is anything that you want, obviously I mainly do this for patients who want to improve something, because I can directly fit a device to you. I think I have 2 or 3 devices left. And you can actually start treatment or training to get your nervous system under control again. So this, for example, would be an at-home device where you perform transcranial direct current stimulation. So through one of these patches, we put a microcurrent through there. It's around 1.6 milliamperes. They go through there, so very, very, very tiny. People usually feel only a slight tingling on their forehead. But in the clinic, we can actually do this viewing the brain live. So we have the EEG and the near-infrared spectrography on your brain, and we see the direct activation of the brain and can do a live stimulation while we do the treatment. The other thing, and this is one of my favorite devices, especially for patients with chronic pain, it's a cranial electrostimulation. So we send one current from one ear to another with alpha waves, and it puts your brain immediately in a state of deep relaxation. So when you do the treatment for the first few times, it feels like you just drank half a bottle of wine. You're immediately relaxed. You're ready to chill out that evening. But it is FDA cleared for insomnia, anxiety, depression. It is cleared for chronic pain, fibromyalgia. It is a very, very powerful device, although it's just attached to your earlobes. But I don't say go out and buy this device straight away just because you identify with what I just said. Yeah, it's laser targeted. So this is not the tool for everyone, but one of my favorite tools. If you want to heal, it's not a journey that you do in one day. It happens every single day. And when you come to the clinic, usually, and this is how I have it with 90% of my sick patients, it's a one-stop shop. You come to me, 4 to 6 weeks. Some patients need less, and some patients need more. But you come to me, and afterwards, you're done. We got rid of everything, and I never want to see you again besides when you come by and show me that you don't have a wheelchair anymore. And there are things that you can do still while you're here, because I have some things with me. So you could map your brain. You can see where you have a dysregulation, where you have an asymmetry in the brain. Is your brain waves, are they slowed? Is something going on up there? You can get a lab test and actually show and prove what kind of infections you have. So we have a mobile health unit set up. You can go there, get your blood drawn by an RN, and within 1 to 2 weeks, the results will be back, and either one of my colleagues can discuss the lab results with you. There are some supplements that you could take mainly as a preventative thing, but I'm not gonna be here and tell you that you can cure Lyme with supplements. And theoretically I could. I have a supplement company, and I produce some of these supplements that also target Lyme. Would I ever tell that herbs alone can get rid of Lyme? No. Although besides being a doctor, I'm also a trained naturopath. I love all herbs, and they're very good, and all my patients also receive a ton of herbs. But this alone will not get rid of your symptoms. It can put it into a state of remission, but you will not get rid of Lyme totally. And if you have any questions, come approach me, talk to me. I love to talk. So if you have any questions, I'm here. And if you or a loved one have been told it's all in your head, there is something that can be done about it. And there's one person you might know and recognize from last year. So I met Jonas exactly, he was sitting exactly over there last year, was sitting in the front row. And he was in a wheelchair with late Parkinson's disease, and he had Lyme for how long? Since you're a late teen, right? Yeah. And he was in a wheelchair for 27 years, right? Want to show what you're able to do? So one of my star patients from last year, he came to me, did the whole shebang. So he had Lyme, co-infections, everything. And in the end, after we got rid of all the infections and we started rebuilding the city, so to speak, we also did neuromodulation. And on day one, when he put his hands out, it was like this. Yeah? Look at his hands today. He was in the latest stage Parkinson's. All of these exercises were not possible. He wasn't able to stand up. He was able to somehow hold himself on a table, but especially not freely standing, and especially not with, see? He's a show-off now. Yeah, so praise the Lord for this, but these results are possible. Yeah, most doctors will tell you if you've been in a wheelchair for 27 years, if you suffered from it, it's impossible. Nothing is impossible. And here is the living proof. Never give up. Good, give an applause to him because he survived my mean program, he survived the cooker. But there are quite a few people that I've already seen at my clinic, and these people have stories to share. So if you want to approach him, you can go to John, if Jonas is willing to. Not everyone, please not everyone go to Jonas, the poor guy. But I think the results speak for themselves. And if anyone amongst you or amongst your families have any problem, there is a place over the pond, but there is a place and our door is always open. Thank you very much.
That's a miracle. I said, that's the closest thing that I have seen to take your bed and get up and walk. Okay. So let me switch out a few things here, and we'll introduce the next speaker. We have a lot of fun with these presentations. All the technology.
Hi, I'm Del Bigtree, executive producer of An Inconvenient Study, and founder and CEO.
Where's the audio? We need the audio cable. Okay, I'm sorry about that. It's right here.
I think it is here.
It's right here. You want to test it?
Greatest decline in human health ever.
Okay.
Hi.
Okay. Please welcome for the third and final time, Mr. Del Bigtree, and he will take it from here.
You guys are gluttons for punishment. I want to thank you all for being here tonight. I especially want to thank John. What an incredible event. You know, seriously, it deserves applause. I go to a lot of events, but I was saying on my social media as you were all passing by, there's something about this event where you really get the sense that the people here are planting their own gardens, are developing new ways of living, getting back to a healthier lifestyle. There's actually change happening here. Instead of a lot of these conferences, I wonder what happens when people go home. They just go back to the city and do whatever they were doing. So it's really great to be amongst people that are change makers. And so give yourselves an applause for being a part of making the world a better place. I really don't want to take a whole lot of time. I asked John, I said, John, I'd actually really love to screen the film. It's now been viewed, I think, 130 million times worldwide and growing, which is super exciting. But when you watch this, what I want you to think about is something: never give up. It's never too late. What Julian is saying, you must always believe that we can heal. And that's not just true for our bodies, it's true for our nation, it's true for our world. And we still have incredible freedoms in this country that you do not see anywhere else in the world. And we need to really recognize we have that, cherish it, and hold on to it. People will ask me, how do you have so much courage to do what you do? And the truth is, it's God, it's faith. And that's true for Bobby. I was really lucky that I got to travel with Bobby for almost 3 years when he was running for president of the United States. He's just an amazing human being that recognizes that he has opportunities some people don't have. And he just every day gets up to make the next right step. And really what you're about to watch has just sort of been my experience over the last 10 years on this issue. I just pray every morning that God blesses me with another opportunity, some idea that I can pursue. And I've been thinking about it a lot. I was having a conversation with a friend of mine recently, and I was talking about how Jesus said if you had the faith, the grain of a mustard seed, you could move a mountain. And my whole life I always thought, how much faith is that? Certainly I have that much faith. And I really couldn't figure out what to do with that passage. But as I was talking to my friend, I had just returned from being in Washington, D.C. It was right after Robert Kennedy Jr. Was sworn in, and I was lucky enough to be standing in the Oval Office when Bobby put his hand on that Bible to become the most powerful position in health in the world. And it's really, I just stood there watching it happening and thinking, this is bigger than anything I dreamed was possible. It's even bigger than if he had been president. We were only running him for president so we could try to get somebody in this position that could fix our health system. And here he is, he's gonna run it. And all I could think was, God is so good and so powerful and dreams bigger than even I do. And I thought, how did we get here? And really, all along the way, I decided to make this movie, Vaxxed. I left my television career. Vaxxed was difficult, but Andy Wakefield and I would argue about the science, and I needed it simpler, and he wanted it complex. I was like, people aren't gonna understand it. They're not gonna understand this movie. We've gotta simplify it. It was this tug of war. Every morning I'd pray, help guide me to work with Andy so I can get him to do what I think is necessary. And every day just moved really one mustard seed. Never really knew where it was going to go. And then after a year with Vaxxed, I started a nonprofit, and I said, we need a lawyer, and almost immediately Aaron Siri, through one of the most miraculous experiences, stepped into my life, and we started moving mustard seeds together. And if you get focused on just the next right step, this all can seem so big, so daunting to look at this Goliath we're up against. If you stare at it, it's never going anywhere. And by the way, if you try to graph this out on paper, how we're gonna win, we lose every single time. But if you get focused on what can I personally do today, just wherever you're at, whether it's share this film with a friend, or we're telling we have business cards you can buy if you go online, or you can make your own, I don't care, your own QR code, your own website, and just hand it to a pregnant woman that's in the grocery store. Say, I don't know if you've thought about vaccines, but here's a card. You can't imagine, we can't imagine how we're being used by God. It is so much bigger than our minds can comprehend. That's why I think we are so blessed to be alive at this time. This is the most important time in human history. We are in that prequel novel to Brave New World, 1984, Fahrenheit 451. You read those books, I was like, how did they get here? We are in those chapters that will decide whether we end up in that horrific, dystopian, displaced nightmare, or whether we are truly a free people and we remain that way. It's in our hands. And so don't look at how big it is, because I can tell you I have not. I don't have long-term vision. I just kept saying, well, I could do that next. All right, yeah, I could meet that person. I can make this call. I can make this film. I can do the things that I can do. And then one day you look up and Robert Kennedy Jr. is HHS Secretary and the world is changing. And the mountain is no longer there. So as you watch this film, this is just one seed I planted along the way. I wanted a vax versus unvaccinated study. I am praying Bobby Kennedy is able to do that inside of the government. Just so you know, as soon as he arrived, the day before he arrived as HHS Secretary, all the former heads of those regulatory departments destroyed the database that he needed to be able to do a comparative study. I mean, think about that. A database that HHS secretaries have used for decades was dismantled before he arrived. That's how afraid they are of anyone really being transparent with the science on this issue. That's why I think this film is so important. But I didn't ask for this dinner with Marcus Zervos. It was just a seed I planted in 2016. I had no idea what was going to go. And after getting through COVID and the major wake-up call that was, and Robert Kennedy Jr., I was just thinking, I wonder what's next. And I was on vacation in the Grand Canyon, finally debriefing with my kids and no cell phones. And, I'd gotten done with Bobby. It was exhausting, amazing. And as soon as I came out of the canyon, I had a phone call, and it was Aaron Series saying, you have a movie to make. Ron Johnson's going to publish the Henry Ford study. And we had 2.5 months to do it, not nearly enough time, although it did, as I said earlier, it forced us to be efficient and get to the point. I think this is the best tool that we've made so far. I just keep trying to figure out how to deliver this conversation in the simplest way. I can't be in your living room. I can't talk to your loved ones that maybe aren't listening. But I pray maybe you can say to them, I'm only asking for 70 minutes of your life, and then we will never talk about it again. Show up with some popcorn. Download it. You're about to watch an inconvenient study. I think it says everything. Thank you. And if you stick around, I'll answer some questions afterwards. Here we go.
Executive producer of An Inconvenient Study and founder and CEO of Informed Consent Action Network. I Can't. What you're about to see is one of the most important stories I've ever told. It's a story of a top infectious disease expert, a study that might have never seen the light of day, and shocking data that could change everything we think we know about childhood health. When the credits roll, I'll be back to share how you can help us deliver an inconvenient study to every corner of the globe. Thank you for being here.
I'm going to run to my hotel and pack.
I hope you enjoy
in
the
like
film.
45 minutes. You want to take-
Children struggling every day with ADHD?
Scott's allergies made it hard to keep up with his friends.
Allergic reactions from accidental food exposure.
Moderate to severe eczema.
Plaque psoriasis, rheumatoid arthritis,
Food allergies.
Allergies.
Seizure.
Asthma.
Eczema.
IBS.
Lupus.
ADHD.
We are now the sickest country in the world. of American children is in crisis.
A huge rise in chronic conditions in kids 17 and under.
More than 40% of American children now have at least one chronic health condition.
Autoimmune disease like rheumatoid arthritis, juvenile diabetes, lupus, Crohn's disease, all this IBS.
I had eczema, asthma,
all but out.
allergies, stomach issues.
This is to me the one that gets me. Just a few decades ago, 1 in 10,000 children had autism. Today it's 1 in 31.
ADD, ADHD, speech-delayed language like tics, Tourette syndrome, narcolepsy, sleep disorders, ASD, autism.
But there's nowhere in the world that these kind of rapid increases in the incidence of disease could be genetic. Genetic change takes generations, centuries to play out.
What's really causing our kids of this generation to be so chronically sick?
What the heck is happening?
America is the sickest nation in the industrialized world. It is now believed that over 54% of our kids have a chronic disease, either a neurological disorder or an autoimmune disease. That's up from only 12.8% back in the 1980s. In roughly 40 years, we have seen the greatest decline in human health ever recorded. What if I told you there is a study that could shed light on this chronic disease epidemic, but no major medical institution seemed willing to do it? What if I told you there was one scientist brave enough to conduct this study?
How you doing, Mark? Good to see you. Yeah, nice to see you. Absolutely. Good.
What if I told you that when the study was finished, that scientist was too afraid to publish it? What would you do? Maybe you would do what I did. I got hidden cameras and recording equipment, and I went to ask him why.
Thank you. You're very welcome. Cool.
You all dined with us before?
I want to show you a video.
Okay.
Curious of what's your reaction to this.
Okay. Just hit play here.
Yeah. Go ahead and press play there.
What was the most shocking thing? Because, I mean, I know what I've seen.
No, I thought it was important. It's important information because of, it did show a difference between the groups.
We have some serious issues.
No, I actually agree with that.
If I can't get this study out, then what hope is there for every kid in the future?
I don't want to say it's not the right thing to do. It's the right thing to do, but I just don't want to.
I mean, obviously, really emotional.
It's sick. It's really sick.
Publishing something like that, might as well retire. I'd be finished.
So who was that guy?
Zervo's probably going to lose his job over this.
You know, I'm thinking before we get into the hidden cameras and the study and Dr. Zervos and all that, why don't we just take it all the way back to how this actually started? I've been a medical journalist for almost 20 years now. My first 10 years was at CBS, and the last 8 years or so I've had my internet news show called The High Wire.
Good morning, good afternoon, good evening, wherever you are.
But the biggest change in my career happened when I produced a documentary about vaccinations called Vaxxed. And at the center of that documentary was a whistleblower from the CDC named Dr. William Thompson. He came forward in 2015 and said that they were committing scientific fraud on the vaccine safety studies. Well, that film blew up and became a worldwide sensation, mostly because we got so much bad press, starting with being kicked out of the Tribeca Film Festival.
The decision to run a controversial documentary about vaccines has Robert De Niro at the center of a big screen backlash.
Tonight, the film festival Robert De Niro started Under Fire, a controversial new film that many are characterizing as anti-vaccine.
I think the movie is something that people should see. There was a backlash which I haven't fully explored. I want to know the truth, and I'm not anti-vaccine. I want safe vaccines.
Vax producer Del
Bigtree says canceling the screening amounts to a suppression of the truth.
I can't imagine what type of pressure came down that would make them pull a movie that they were obviously behind in the beginning.
The message from the medical community is clear.
This is one of those scientific questions that where science has provided an answer.
Vaxxed ended up being one of the most controversial documentaries in history. And because of that, there were lines down the block everywhere we went.
Look at this crowd behind me. Look at this line goes on and on and on.
In fact, the very first day we screened at Angelica Film Center in New York, I wanted to know why there's this giant line down the block. What are these people here for?
Can every parent or someone, if you have a family member with autism, would you please stand up right now? I'd like to see.
3/4 of the room stood up. I remember feeling like the air just got sucked out of the room. I had no idea that there was this many people suffering from this issue. I ended up asking that question 3 screenings a day, 5 days a week for an entire year. And every single time, 3/4 of the room stood up. I realized I had stumbled on something absolutely massive.
Hello, everybody. This is Jamie. Jamie's first. Can you guys both tell us your names?
I'm Stephanie.
And this is Zion.
After the screenings, parents of injured children were inspired to tell their own stories. We set up video cameras and started interviewing everybody that wanted to talk. And what I discovered is it wasn't just autism, and it wasn't just the MMR vaccine. There was an ocean of vaccine injury, and nobody was talking about it.
Doctor says, well, do you want the flu vaccine? I was like, might as well do it now.
I gave it in. I did polio. I gave her the Hep B vax. She got the 2-month shots.
Detail. The MMR vaccine.
By 10:30 that morning, she was arching her back, clenching her fists. I didn't think I was going to cry.
That night, we were in the hospital with the 106-degree fever.
He began to projectile vomit. He began to this loud pitch scream.
Like that's when the blood curdling scream started.
I did not lay down for 10 months straight because she would vomit and asphyxiate.
She would vomit at night and she would lie there while she was asleep and she would choke on it.
When we had that vaccination, he lost all language.
He just stopped talking?
He wasn't talking. He didn't want to nurse.
He went to not talking at all.
He was developing